Welcome to this edition of AFMC
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Mr. Randy Barymon. He is the hospital administrator for St. Bernard's Five Rivers Medical Center in Pocahontas. Randy, thank you so much for joining us.
Thanks for having me.
So tell me a little bit about St. Bernard's Five Rivers and what you're in Pocahontas, and tell me about the area that you serve.
So we are in Pocahontas, as you stated. I believe population somewhere around 8,000, pretty rural community, a lot of farming, manufacturing, things of that nature. So kind of fits the bill of most rural communities here in Arkansas.
And St. Bernard's is the first in the state to opt into a new program that is it to bolster federal funding for rural hospitals. Tell me a little bit about it. So it's a new designation for rural emergency hospitals.
That is correct. Yes. Federally, it was passed in January 1 of this year. Arkansas did pass the REH, or the Rural Emergency Hospital, in, I believe it was February. The state went to work rather quickly to establish the rules and guidelines for the state of Arkansas. And I believe it was June, maybe, whenever we started the application process. And we converted to the Rural Emergency Hospital on September 1 officially.
And is this new rural emergency status considered a new way for hospitals to treat Medicare patients, Medicaid patients? How does that work?
So yes, we, of course, we're able to treat all patients, all payers, whether you're able to pay or not. Want to get that out there. So we do get a 5% increase in Medicare payments through this model, and then we also do receive some other federal government assistance as a monthly stipend through the REH model.
And becoming a rural emergency hospital will help St. Bernard's Five Rivers keep up with increasing demands for both outpatient and emergency services. Is that correct?
Yes. So, as we were considering this model, we wanted to establish the emergency room, and we wanted to make sure and bolster our outpatient services. As most folks in rural healthcare know, there's a decreased demand for inpatient services. So we were seeing far less inpatients as we see a lot of growth in our emergency service and outpatient services. I think 6% growth in our emergency services this year. So we really wanted to evaluate, what are the needs of the community, what services are being utilized, and how do we ensure that we're able to continue those services in the future. So as we looked at the REH model, we determined that currently only about 5% of our business is inpatient. And through this model, you are no longer able to provide care for inpatients, but you can keep patients in an observation status. And it gets a little bit confusing, but we like to use the term short stay versus long stay patients. So we can keep patients in the facility for, an annual average of 24 hours. That doesn't mean after 24 hours we remove you from the hospital. It just means an annual average. So we currently have patients that are staying two or three nights in our facility, and that will be our kind of current practice moving forward. So I wanted to kind of clarify that, because there has been some confusion here in the community as far as the length of stay that we can accommodate here.
Thank you for clarifying. And more importantly, your emergency room remains open.
Exactly. That was, as we talked about this new model with community leaders here in the area, that was what they talked about the most, was whatever you guys need to do to keep those emergency doors open. I would hear story after story from community leaders or, folks at the supermarket talking about how our emergency room either saved one of their family members' lives or a friend of theirs or whatnot. So everyone echoed those remarks of whatever it takes to keep our emergency room open.
And you touched on this briefly about rural healthcare, and it's something that we're hearing about in all facets of healthcare. And Arkansas isn't alone in this, right? We're seeing lots of states that have been looking for ways to implement this type of program in their area.
Correct. Yeah, I was just at a rural healthcare conference in Kansas City a few weeks ago, and there were folks there from all over, and they all echoed the same remarks. Cost of care has gone up, reimbursement has not followed suit, and some have even seen a decrease in reimbursement. So it's definitely not just Arkansas. Anybody that follows healthcare right now, you read, day in and day out that hospitals are at risk of closure. And it seems like every week I pick up the paper, there's a new hospital closing week after week. So uncertain times right now for healthcare for sure.
But this designation does help not only St. Bernard's, but the community in that area of the state for sure as well.
Yeah, really, it gives the facilities a chance to remove services that aren't being utilized and gives you the resources to prop up or add new equipment or whatnot to the service lines that really are being used, or new service lines that maybe you need to provide to your community. It gives you a little bit more financial stability to better those service lines.
And will patients notice a change in the hospital at all? Does this mean anything to the patient when they walk in the door?
So honestly, I don't think that people really wouldn't notice the change. Of course, if somebody was accustomed to coming to the hospital and staying, 5 or 6 days or maybe longer, that would be different now. But for those patients that would typically come into the hospital for 2 or 3 days of service, and then we would discharge them home or back to their nursing home or whatnot, those folks would never know the difference. We're still providing excellent care here at Five Rivers. You see all the same staff taking care of their loved ones. So really there's not a whole lot that's changed.
And before we close, what do you want healthcare providers, community partners in your area, right across the state, to know about the designation and about the work that you do there?
So first and foremost, we're still here. We're open. We are looking to better the healthcare here at Randolph County. We are currently evaluating new equipment that we need to purchase, and we're gonna be here for a long time to take care of the community. And more importantly, we're still open for business. We are still looking for, we can still take patients into the hospital that can stay the night multiple nights. And we're ready to serve.
Well, Randy, thank you for talking to me, and I appreciate your willingness to explain the program and the grant, and also all the work that you're doing to better healthcare across the state of Arkansas and specifically in your community. Thank you.
Yeah, thank you so much for having me.
And that's it for AFMC TV. Thanks for watching, and have a great day.